Good morning, guys. Today we are going to discuss about a topic in hematology that's about red cells. Yes, normal cells in human body. In our discussion, we will include normal shape, size, and functions of each cells, also the physiologic and pathologic abnormalities of the cells. At first, let me discuss about a picture of hematopoiesis. What is hematopoiesis? Hematopoiesis is the process of formation of blood cells. From where blood cells are forming? Blood cells are forming from bone marrow. It is a formation of blood cells. Hematopoiesis is the formation of blood cells. During intrauterine life, hematopoiesis begins in the liver and spleen. After birth, hematopoiesis in liver ceases and blood cells are produced from bone marrow. There is a multipotent stem cell present in the bone marrow. Multipotent hematopoietic stem cell or hemocytoblast, which gives rise to a myeloid and a lymphoid stem cell. That is myeloid progenitor and a lymphoid progenitor. It is forming from multipotent hematopoietic stem cell. From myeloid stem cell, erythrocytes, granulocytes, monocytes and platelets are forming, and same like from lymphoid progenitor, lymphocytes are forming. The process of formation of myeloid series is known as myelopoiesis and the formation of lymphocytes are known as lymphopoiesis. Okay, it's a big process. Hematopoiesis I will discuss you in another class. Okay. Now we can go to normal cells. There are three types of cells in your blood: RBCs, WBCs and platelets. RBCs. Normal RBCs are biconcave disc shaped. It's uniform in size with an average diameter of 7.2 micrometer. 6.7 to 7.7 micrometer is acceptable. They are pink in color while staining with the right stain. Centrally pallor, about one-third of the volume. Central pallor depends on hemoglobin concentration. If the hemoglobin concentration is low, the pallor will increase. Variation may be due to physiological and pathological. That means the increase or decrease of the RBC depends on the clinical condition of the patient. It may be physiological or pathological. Physiological increase at birth or hemoconcentration. Hemoconcentration means during dehydration, diarrhea, vomiting. If the patient is in high altitude, severe muscular exercise, these kind of increase is known as physiological increase. When it is decreasing old age and pregnancy, it is physiological decrease. Pathologically, RBCs are increasing. The condition is termed as polycythemia and the decrease is known as anemia. Now we can go to neutrophil. In normal, when we are checking the blood cells, normally band neutrophils, almost 5 to 10% of band neutrophils and mature neutrophils are finding. The cells are 10 to 15 micrometer in diameter, round shaped with typically rod shaped or band like or sausage like nuclei, having coarse agglutinated nuclear chromatin in deep violet pink color. The cytoplasm is abundant and pink with a large number of small violet pink granules. Band neutrophils also known as stabs. An increased number of bands may be noted in the blood in a number of physiological and pathological states like infectious, inflammatory processes, tissue damage or necrosis, neoplasia, poisoning or intoxication, drug effect and metabolic abnormalities. Band neutrophil increase and the presence of metamyelocytes, myelocytes or even promyelocytes in peripheral blood are referred to as left to shift. When we are running FBCs in an analyzer, it will show. It will give flags like left shift, left right like that. Left to shift means there is some infections. And commonly seen in infections, acute poisoning, acute blood loss and aplastic anemia. Now we can go to segmented neutrophil. Mature and segmented neutrophils are the most predominant white cells in normal adult blood films. The cells are 10 to 15 micrometer in diameter with a lobulated nucleus. The cells having deep violet coarse nuclear chromatin with abundant cytoplasm that contain a large number of light pink, small and uniform neutral granules. There is lobes, it is interconnected, there is pink granules in the cytoplasm. Increased neutrophil count with more than 3% neutrophils containing 5 or more nuclear loops in peripheral blood smear is referred to as right shift. Commonly observed in patients with nutritional megaloblastic anemia under anti-metabolic drug treatments or during recovery from inflammations. A severe right shift of nuclei is often accompanied by a decreased total white blood cell count, suggesting a decline in bone marrow hematopoietic function. That should be noted. Now, variation, physiological and pathological will be there. Physiological increase in coming in infants, pregnancy, menstruation, exercise and high temperature, and decrease old age, early morning. Early morning samples, not always. Sometimes early morning samples, the decrease we can note. Pathological increase, bacterial infections, leukemia. Decrease viral infections, some bacterial infection like brucellosis, radiations, anemia, cirrhosis and rheumatoid arthritis. Lymphocytes. Lymphocytes are small, round to ovoid cells ranging in size from 7 to 15 micrometer with an NC ratio ranging from 5:1 to 2:1. Most lymphocytes are round to oval nuclei that may be slightly indented or notched. Okay, nuclei. You can see here. Most lymphocytes have a scant amount of pale blue, moderately basophilic agranular cytoplasm. Look here, cytoplasm. Occasionally, the edges may be slightly frayed or pointed due to artifacts induced during smear preparation. Occasionally, lymphocytes will have a small clear zone or HOF adjacent to one side of the nucleus. Now, physiological increase in lymphocytes may occur in children. Infants, children, it is increased lymphocytes. A pathological increase in lymphocytes is associated with certain infection induced by viruses or bacteria, some kind of bacteria, mostly in viruses, such as mumps or infectious mononucleosis. Bacterial infection in mumps and infectious mononucleosis. Chronic infections during recovery from tuberculosis and acute and chronic lymphocytic leukemia. Now we can go to monocytes. It is the large size. Monocytes are large cells approximately 12 to 20 micrometer in diameter. They are typically round, oval or irregular in shape with or without pseudopods. The nucleus is twisted irregularly. You can see here, see, nucleus is irregular. Some are kidney shaped, some are, anyway, it is irregular. There will be vacuoles. Sometimes like a mountain, sometimes like a horseshoe. And reticulate and stained light violet red. Okay, the cytoplasm is gray blue. Cytoplasm, look, gray blue or gray red, translucent, commonly vacuolated and contains small dust-like violet red granules. You can see the cytoplasm granules and vacuoles. A pathological increase in monocytes may be observed in infectious disease such as subacute infective endocarditis, malaria and Kala-Azar. It could also occur in the recovery phase of acute infections and certain hematological disease such as the recovery phase of agranulocytosis, monocytic leukemia. Now, eosinophils. The cells are 13 to 15 micrometer in diameter, typically round with a glass-shaped two-lobed nucleus, bilobed nucleus. It's bilobed nucleus with orange granules in the cytoplasm. Eosinophils contains a variety of enzymes such as peroxidase, phospholipase, decatelase, and acid phosphatase. Eosinophils are less capable of killing bacteria than neutrophils. Defense mechanism, it is less involved. And an increase in eosinophils can be observed in parasitic infections and certain types of allergies. Basophils are 10 to 12 micrometer in diameter, typically round, and the nucleus is obscured by granules. Okay. Nucleus is masked by granules, which are violet, black, varied in sizes and unevenly distributed in the cells. The chromatin is coarse and violet. An increase in basophils may occur in specific allergies, myeloproliferative disorders, and basophilic leukemia. Platelets. Normal platelets are about 1.5 to 3 micrometer in diameter. They look like slightly biconvex discoid structure. Look the platelets. Mostly round, oval or slightly regular, containing no nucleus. Platelet doesn't have nucleus. Clustered or dispersed in the cytoplasm, which is usually light blue or light pink. Platelets are produced by megakaryocytes in hematopoiesis. I just mentioned about that. I will give a detailed class about that later. The platelet functions such as maintaining endothelial cell integrity, aggregation, adhesion, release, procoagulation and clot retraction. The condition in which platelets are increased is called as thrombocytosis and decrease is called as thrombocytopenia. Yes, we can wind up our class today.